Dr. Robin Rose, a gastroenterologist and long COVID specialist and CEO and founder at Terrain Health. Dr. Rose, thanks for being here.
Thanks for having me, Rob. I appreciate it.
So we took these vaccines. Joe Biden mandated these vaccines, but these mRNA vaccines were totally untested and they were filled with something called spike protein. What are these vaccines doing to people today? What are you seeing at your practice?
So just to understand, the most pathogenic part of the virus is the spike protein. And when they made the mRNA vaccines, they used that part of the virus to put in the vaccine so that we can mount an antibody response to the disease or to the virus. So they didn't realize when they did it at the time that they used the most pathogenic part of the virus, and that's the part that had the gain of function as well when it was made in the laboratory. I want to make it clear, though, that the vaccine and the virus are equally as dangerous when it comes to the spike protein, but we do have solid evidence showing that the spike protein itself from the vaccine or the virus drives the disease, the underlying disease pathology.
Okay, the FDA put out some guidance just recently that people could be dealing with issues, sudden death even, heart issues for between 5 and 10 years. I get the 5-year part because we're 5 years out now, but where do they get the 10 or 15-year number? Because they really have no idea, do they?
So the research I'm involved with currently and have been involved with for the past 4 or 5 years, and I work with a very fantastic collaborative group internationally, and we've been looking, at all the different research papers coming out and doing our own research itself, show that the spike protein can live inside the cells for months, if not years. And that's a spike protein both from the virus and the vaccine. Our data sets and the data collection that we have show for any given cohort of patients, a third of patients are carrying around the spike protein still from the vaccine, even if the patient was vaccinated even 3, 4, 5 years ago. And you can be a hybrid. You could be carrying around spike protein from the vaccine or the virus. And we use very advanced diagnostic technology like mass spectrometry that can delineate the spike protein from the virus versus the spike protein from the vaccine. And we can actually look at blueprints and create blueprints of each individual showing where the spike protein is sitting inside their bodies.
And so we're just like spike protein producing factories, and they forced us to take this vaccine. And sure, this can happen from the virus, but people that are getting, look, Joe Biden's got stage 4 prostate cancer that metastasized to his bones. His doctors missed this. He's had 6 COVID shots and boosters that we know about because he did it on camera. Do you think that Joe Biden is vaccine injured?
He could be. I'd have to test his blood. I'd have to take a blood spot from him.
But wouldn't that track? Wouldn't that track something like that? That much spike protein in your system wreaking havoc?
It could, but it's the combination of the vaccines and exposures to the virus.
Okay, $1 million question. $1 million question. We've got the spike protein in our bodies. Anybody that was vaccinated, anybody that has COVID, you can, by the way, take a COVID antibody test at a place like LabCorp and see how much spike protein you've got. And if you haven't gotten COVID in a long time, that at least gives you a baseline, I guess, to know how much you're producing. But let me just ask you, I know your entire life, your entire practice is dedicated to this now. Are there simple things people can do to try and heal their bodies?
Yeah, I just want to assure everyone's, obviously it's very upsetting to hear this. People don't, want to push it under the rug.
Right.
There are so many solutions. We have been, I work with, again, all of these physicians and scientists and researchers around the world and country, and we're driven by data and patient outcomes. And we have tons of solutions, and we look at cellular medicine, or what's called root cause medicine, to get to the bottom of what's going on with the patient and to understand and implement the right interventions so that the patients get better. That's something usually dismissed and overlooked by the general medical community, root cause medicine. And the type of doctors and physicians that can help patients like this are doctors that have a clear foundation of cellular medicine. The spike protein and the virus, they impact over 250 different pathways in our body, but there are clear, concise interventions that can help rid the body of the spike protein and also take care of the downstream impact and inflammation from having the spike protein in your body for several months, if not several years at this point.
There are so few doctors out there that are doing what you're doing. Keep this up. And I'll just mention, this is not getting attention from the rest of the media. It's not getting attention. The media is covering this by covering it up. Donald Trump posted about this yesterday. It's very important that the drug companies justify the success of the COVID drugs. Operation Warp Speed was brilliant, as many say it was. If not, we want to know why it wasn't and why. So Donald Trump is now at least aware of this and what is going on with a whole lot of people. Dr. Robin Rose, keep doing what you're doing. Come back and see us. Thank you.
Thank you. Thanks for having me.